Topic under discussion is angina. Now this topic is going to be made very easy. How? Like very simple. First of all, I'll tell you what is angina. What is angina? Then we will define this angina pathologically, physiologically, pharmacologically. After that, we'll talk about the factors responsible to cause angina. Then we will talk about the factors responsible to alleviate angina. Then we'll talk about the etiology, pathophysiology of angina. And here we'll be discussing atherosclerosis, okay, which is actually one of the most important factors responsible to cause angina. After discussing all this, we move towards the clinical presentation. Then we'll talk about the diagnosis. After that, we'll move towards management. Here, we'll discuss non-pharmacological and pharmacological management. Okay, let's get started from the very first point. What is angina? Simply speaking, it is actually chest pain. Severe type of chest pain is called angina. Now, let's move towards the medical definition. Okay, in short, it is a clinical syndrome characterized by discomfort in the chest. Okay, it is a clinical syndrome. Now, what is happening in this? We feel discomfort in the chest. Then that discomfort, which is actually pain, that will radiate towards the neck, jaw, back, and arm. So this is called angina in simple medical terminological definition. Okay. Then let's come towards this new point, that is the factors that are responsible to cause angina. In some cases, stress, and in some cases, physiological exertion, and some other factors are also responsible to cause angina. Most common is stress and physiological exertion. Now, this angina, this chest discomfort, this is actually relieved by using nitroglycerin or taking rest. And there are some other factors also responsible. Okay. Now, this is just the briefing through which I'm making you people understand about the angina. This was the definition. What is angina? Simply, it is actually chest discomfort. Then we talked about the factors responsible to cause angina, that is stress, physiological exertion. Then we talked about the relieving factors. They are actually rest and nitroglycerin. So these are actually the very basics that we just got a moment earlier. Now let's come towards the etiology and pathophysiology of the angina. So now I will explain here the atherosclerosis. This is the very basics. If you know about the atherosclerosis, you will come to know about the entire concept of angina. Okay, very simple. Before moving towards the atherosclerosis, let me make you people understand about this particular diagram. Now, this is actually consider it as a heart, okay? Here are the blood vessels supplying the blood to the heart, named as coronary arteries. Now, these coronary arteries are responsible to supply blood to the heart. What happens with the passage of time due to some factors inside these blood vessels? The blood vessels that are supplying the blood to the heart, okay? In these blood vessels, in the coronary arteries, plaque formation takes place. You can say an obstacle is actually formed here to the blood flow. If there is no obstacle, the blood will flow in a very simple and easy way. If here comes an obstacle, what will happen then? Then the blood flow will be reduced. Due to which, what will happen? Very simple. If the blood flow to the muscles of the heart is reduced, we call that a condition is reduced in the supply of oxygen to the heart. So if the heart is not receiving oxygen, then the heart will not function well. What will happen? Its metabolism will change. In the meanwhile, if metabolism is changing here, there are some factors like pyruvate and lactic acid produced. Those factors, pyruvate and lactic acid, they are responsible to cause pain in the heart. That pain is actually known as angina. Okay. Now, what was the main factor here? And what is the main factor here? That is obstacle formation, known as plaque formation. When this plaque formation takes place, this will cause reduction in the blood flow to the heart, to the myocyte, cardiac myocytes. So now if cardiac cells are not receiving enough oxygen, metabolism will be disturbed. At the end, there will be the synthesis of lactic acid and pyruvic acid and etc. etc. That will all lead towards the pain. So then painful sensation will be observed. Now these painful sensation observed because of what? Because of decrease in blood supply. We can say in short, because of decrease in the supply of oxygen. So here, if we are talking about in the heart, decrease in supply of our blood, by that we actually mean decrease in supply of oxygen. So you can use both the terms. Decrease in supply of our blood is equal to decrease in supply of oxygen. So if the heart is not receiving oxygen, the heart will then pain, in short, in simple words, okay? Now this pain is actually known as angina. Now let's come towards the atherosclerosis. Remember, some of the students, they mix athero with the arteriosclerosis. Concentrate here. Here we have athero, not artero. Artero is actually the hardening of the artery. Now, athero here it is actually the plaque formation in the coronary arteries. Okay. So now this plaque formation, how it is caused. Now let's discuss this in a very simple and easy way. We know that the blood vessel, now this coronary artery has got three important layers: tunica, adventitia, media, and intima. 3 years. Then this layer is actually covered by endothelial lining. What happens in some cases, this endothelial lining is actually eroded, removed. Now, if it is removed, then the floating LDL will find this free space. That floating LDL then will diffuse into the intima. Now, as this LDL reaches the intima, in the meanwhile, there will be monocytes traveling here in the blood. They will also come and will diffuse into the intima. Now here is the enter, they will become macrophages, LDL will become oxidized. Now these macrophages and oxidized LDL, they will interact. How? Like macrophages will start eating these LDL. And then these macrophages will be named as foam cells. Now these foam cells are responsible to do further complications, okay? They will call more here collagen, smooth muscles cells. So like this, they will cause proliferation of the smooth muscle cells from the media, tunica media from the second layer. So here smooth muscle cells are coming. In the meanwhile, here we're having LDL, macrophages, T cells. So these will actually form the fatty streaks, okay? And foam cells, along with all these, they will help in the synthesis of the plaque heart structure. So now what will happen? Slowly and gradually, this particular structure will bulge out. Now this bulging will result in the plaque formation. This bulge may remain the same and this may rupture. If it ruptures, then that condition is named as what? Actually thrombus formation will take place here. Then this may move also along with the blood pressure. If the blood pressure is increased, this may move also with that. There are some other complications also. In short, here what is happening? Accumulation, plaque formation is happening all here. With the passage of time, its size will increase. So as it is increasing with the time, it will cause decreasing in the diameter of the blood vessel. So if the diameter of the blood vessel is decreasing, that will result into decrease in supply of the oxygen to the heart, to the cardiac myocyte. And again, if the heart is not receiving oxygen, what will happen? Metabolism will be changed and painful sensations will be observed. Those painful sensations are actually known as what? Angina, anginal pain, chest pain, in simple words. So what happened here in short, let's summarize this all. LDL got a free space here because there was no endothelium. Then though that LDL entered, it was then oxidized in the intima. Then here the monocytes were traveling also in the blood, that also diffused in. They became macrophages. Then those macrophages phagocytosed the oxidized LDL. They became the foam cells. Those foam cells were much reactive, much active. They then caused the proliferation of the smooth muscle cells of the media. Along with that, here the LDL, macrophages, and some other T cells, they when they were summing up together, they were synthesizing the fatty streaks. Now these fatty streaks plus all these collagen and smooth muscles, they will sum up together, they will add up together, and they will result into the plaque formation. So that's it all about the plaque formation and plaque synthesis. So this plaque is responsible to decrease the blood supply, and this plaque, with the passage of time, it may rupture. That will then form thrombus formation, and this will then occlude the entire blood vessel. Or if there is no thrombus in formation, there is just the formation of thrombus, and this formation is actually a kind moved within the blood vessel within this coronary arteries. So that is then called as embolism. So all those cases, they will lead towards myocardial ischemia, That ischemia will then, if prolonged, if not treated, will move towards infarction, and at the end, what will happen? Heart attack may lead to death. Okay, that also. So this is all about the etiology, pathophysiology of the angina or the atherosclerosis in short. Well, now let's come towards the clinical presentation. As it is angina, we discussed a moment earlier, there will be a severe type of chest pain, there will be breathlessness. Now this pain will be of very strong quality, okay? Very extreme type of pain will be that. And duration will be from zero point 0.5 to 30 minutes. And in most of the cases, it is observed that this painful sensation lasts for 10 minutes. Then it is actually subsided on its own. Anyways, coming towards the diagnosis, there are some other complications also in clinical presentation. Now, this is in short a review form, which is actually, now these are actually seen in most of the patients. Now, let's come towards diagnosis. Here, we'll ask the patient about the history of signs and symptoms. Then we'll go for the ECG. In that, we will observe ST depression and T wave depression. We'll check the ST segments, okay? Then after that, we have the next option that is for cardiac test. Then we can go for echo also, where we will identify the size, shape, capacity of the heart, and then we will do the angiography also. So these are the very basic tools that can be opted for diagnosis purpose. Then we have management, how to manage. Now this is actually a kind of overview, okay? Don't be confused. In the management, we have two sorts of managements we can do. Number one, non-pharmacological. Number two, pharmacological. In the non-pharmacological, we are actually suggesting patient some tips and tricks like avoid smoking. We'll talk to the patient, please avoid smoking, reduce smoking, and we'll suggest the patient to do the exercise, to increase the exercise, and to focus on weight loss. Along with that, must have proper diet, okay? Cholesterol-free diet must be consumed by the patient. So this is actually the very basics regarding non-pharmacological management. Here we have pharmacological management. This management is based on the patient, okay, the condition of the patient. In the beginning, we'll start from the nitroglycerin 0.3 to 0.6 mg. Nitroglycerin will be indicated. Along with that, aspirin will be indicated 75 to 10 mg, 150 mg, okay. So if the patient is allergic, then we will shift towards clopidogrel 75 mg. Along with that, we can indicate statins. As we know, here is LDL available. So our main focus will be here regarding treating the anginal patient. Now, anginal patient is receiving this kind of condition because of what? Means what is the reason behind chest pain? Here we talked about narrowing of the blood vessel, and the heart is not receiving enough blood supply, enough oxygen is not received by the heart. So in order to acquire this condition, we can say in order to alleviate this condition, what will we do? We will give such drugs which will dilate the blood vessels and which will also decrease the heart rate. Means two things are supposed to be gained by means of these drugs, by indicating all these drugs. Number one, dilating the blood vessels. If we dilate the blood vessels, then the supply of the blood will be increased to the cardiac myocytes. So like this, the pain will be relieved. Why? Because there is now enough oxygen available to do the metabolism and to help out the cardiac myocytes. And another case is that we will function, our main theme will be to focus the heart rate. If we focus the heart rate, during systole and diastole, so if there is a fast systole and fast diastole, again, there won't be the proper perfusion of the blood to the cardiac myocytes. If we give such drugs like beta blockers and calcium channel blockers, they're actually helping us to decrease the cardiac heart rate. What will happen in this? In this, we will get the time, the gap between systole and diastole. Now, in this condition, there will be slow contraction and slow relaxation. Now, in this slow contraction and slow relaxation, in the meanwhile, there will be proper perfusion available. Okay, proper perfusion will be done of the blood to the myocytes. So, like this, dilating the blood vessel and decreasing the heart rate. These two are our main targets. If we get these like this, we will be able to get proper blood in the cardiac myocytes. So if there is a proper blood supply, there won't be any pain felt then. Got it? So we indicate statins. Okay. Now statins are actually supposed and responsible to cause a plaque formation. Okay, to increase. So if we give anti-hyperlipidemic like statins, they will decrease this LDL. So like this, again, we're actually countering a kind, you can say, elevating the plaque formation. There won't be then the plaque formation available. Here we're giving ACE inhibitors also. Now, one of the uses of the ACE inhibitors is that they are actually responsible. ACE and some endothelins. They're responsible to cause vasoconstriction. So if you give ACE inhibitors, there will be vasodilation. Again, our function is achieved. Vasodilation and decreasing the heart rate. Beta blockers and calcium channel blockers. Told you in the beginning, if you block the beta blockers, if you give the beta blockers, so they will block the beta receptors, and beta receptors plus calcium, they are responsible to cause what, in a nutshell I'm talking, they will cause decrease in the contraction and relaxation of the heart. So like this we will get diastole time. So in that we will be having proper perfusion. And so if a blood is if a heart cardiac myocyte is given time to perfuse, means if the time is increased of the cardiac contraction and relaxation, so in that condition then the blood supply to the heart will be actually increased. So that's actually achieved by inhibiting beta blockers, by indicating beta blockers and by inhibiting beta receptors and calcium channel blockers. So long acting nitrates can be also given in this case. Now this is actually a kind of increasing in therapy. Okay, these are the stages. So if the patient is not responding properly, then we can indicate with the beta blockers long acting nitrates. After that we can switch towards the calcium channel blockers also. And sometimes again, if there is a kind of complication observed, then we can switch towards potassium channel openers. So after the statins and ACE, here is our actually dose optimization needed regarding beta blockers, calcium channel blockers, and potassium channel openers. So we will go through all these. We'll optimize the doses. So if still there is no any proper response, or there is actually a kind of no proper alleviation of signs and symptoms, then we will move towards revascularization. That is actually the last step in which we go for checking the bypass, means going for through surgery, in short if I speak. So this is all about the angina and its different stuff. If still you have confusion, drop in the comment box. We'll answer inshallah. Thank you for watching.